Bariatric surgery reduces the size of your stomach, so drinking enough water to stay properly hydrated can be challenging. In this module, we discuss your fluid goals and methods for achieving them. We'll also look at some of the fluids you will want to avoid after surgery and some tips for drinking comfortably.
So one of the challenges that you'll face after surgery is getting enough fluid in. And it's actually, I'd say, priority one when you leave the hospital.
After surgery, it's important for you to get 64 ounces of fluid in each day. And initially, the only way you're going to be able to meet this goal is just by keeping something with you at all times. So when you're running errands, when you're at the office, always keep some water around so that you can get that goal in, because you'll find that it's very difficult to meet it initially because your stomach is so small.
If you're not well hydrated, you're going to develop some fatigue. You may notice a drop off in your urine output or your urine flow. You're not having to go to the bathroom as frequently. You may feel a little bit lightheaded or dizzy, particularly when you stand up or get up from a lying position. If you're really having a lot of trouble with that, then we would really recommend that you contact our office. Occasionally we have to bring patients in and give them some IV fluids and check their electrolytes, make sure that those are in balance.
When thinking about fluids, water is always best. Also, you can try non-carbonated and sugar-free beverages such as sugar-free Kool-Aid, Crystal Light, Powerade Zero, or Mio water flavorings. Decaf coffee and tea are fine, sugar-free popsicles and Jell-O. If you find that you are nauseated coming off anesthesia, sugar-free popsicles work great to soothe that nausea. Also, you can try zero-calorie flavored drinks that are carbonated and caffeine-free. Any fluids that are added to your protein supplement, whether it is water or milk, can be counted towards your fluid intake for the day as well. If you want to make your water more interesting, try adding lemon, lime, mint, orange, or grapefruit slices for flavor. Caffeine is a diuretic, and so you want to make sure that you limit it to 16 ounces per day after surgery. There's also some research that shows that caffeine can lead to marginal ulcers, which are extremely painful. So another reason that you need to limit your intake. If you want to, wake up in the morning, you want to drink a cup of coffee, you need to take in an additional 4 glasses throughout the day to prevent that diuretic effect from the caffeine. Carbonation leads to gas, bloating, and abdominal distension after surgery. It can also impair the healing process. It is important to wait a minimum of 3 months before introducing carbonation back into your diet. When you do, it's important to do it in small amounts and be very cautious.
So one of the questions you may have is, after surgery, can I drink alcohol? And certainly we would recommend that you hold off on that for a little while after surgery. In fact, probably it's best to wait until you've gone through your entire dietary evolution and you get to a pretty stable diet where you're eating regular foods and where you're staying hydrated, you're able to take in enough fluids, because one of the things that alcohol can do actually is dehydrate you. So if you're not getting enough water in and you drink alcohol on top of that, it can lead to or contribute to dehydration. So alcohol consumption can be a little bit tricky after surgery, and I think that it's always important to go slow and to once you're well hydrated, once you're on and you've become accustomed to your diet, you can introduce alcohol back into your diet.
Let's take a moment to review this module. Sip fluid slowly. Gulping can increase your risk of vomiting. Some people find drinking through a straw creates discomfort. Don't drink while eating. Fluid will reduce the space available for food and may lead to nausea and vomiting. Wait 30 minutes after eating before you start drinking again. Avoid very hot or very cold liquids. Avoid carbonation and limit caffeine and alcohol. Carry water with you all the time and track your fluid intake in your journal. When you are ready to continue, use the menu on the left to select the next module.